Hello, everyone, and welcome to Health Analytics Asia. This week, we are talking about Malaysia, a Southeast Asian economic powerhouse that, as of February 23rd, has recorded over 288,000 cases of COVID 19 and over 1,000 deaths. Active caseload is still over 30,000. Vaccinations against the disease have begun today as the country remains in a state of emergency. To talk about all this, we have with us Dr. Ahmad Firdaus, Medical Officer with the Government of Malaysia and founder of Medical Mythbusters Malaysia, a group of doctors and medical professionals tackling and debunking medical myths and misinformation in the country. Dr. Firdaus is also a member of our award-winning initiative, First Check. More on that in the description below. Dr. Firdaus, welcome to Health Analytics Asia. First off, uh, give us an insight. Just talk us through the whole process of how Malaysia has managed COVID-19 so far.
Yeah, hi Tariq. Thank you for having me tonight.
Pleasure.
So since 2020, we started the first COVID cases were in January 2020, and since then it's been now we're in 2021. It's been a very long process, very long path towards this. Now that we have the vaccine, it's something promising for us. So since the beginning in January 2020, we started with a lot of initiatives. Immediately after the first few cases of outbreaks in Malaysia, whereby there were plenty of clusters here, we started with the movement control order, whereby our movement was restricted. If I'm not mistaken, it's almost the same. It's not a full lockdown. Some essential services were still allowed to go on, but mainly people were encouraged to work from home, and there was no interstate travel. Even inter-district travel was limited then. And then we successfully managed to bring down the cases. But then we had a second wave sometime in uh, September, if I'm not mistaken. And then subsequently, we've been having higher highs of cases. Only now, since the past few weeks, we've been managed to bring it down a little bit from the highs of 4,000 plus to now around 3,000 plus cases per day. Yeah, it's been a long and tiring process. So we've gone through a lot of multiple versions of movement control orders. We've managed to bring it down a bit every time we've implemented that. But there are some clusters that we had clusters in the prisons, clusters in the workplace, especially factories and stuff. So those were the ones that were bringing it higher. And then it's undeniable that the COVID-19 is within the community, and we've encouraged people to have the physical distancing, face mask wearing, and also encourage the use of hand sanitizers and also hand wash.
Glad that you mentioned the movement control order because part of pandemic management everywhere has been lockdowns. Now Malaysia's version of lockdown, not entirely lockdown, but yeah, movement control order. It did go into a bit of controversy when people were arrested by the hundreds for violations of the MCO. How do you see that the arrests basically?
So depends on. I mean, on a public health perspective, the movement control order was one of the component in the management. It's not the only component, but it's one of the management of a pandemic, especially such as something like COVID-19. So in order for the movement control order to be implemented properly, that's the need for enforcement. The all those people who were caught were in violation of the movement control order actually. So that's the reason why, because we want to make sure that the public know that this is something serious. Everyone needs to be involved, and those who flouted these rules, essentially they were becoming a threat or harmful to the public health in terms of COVID-19. Thus, we needed to show that we mean business. That's why all these implementations were in place.
But then did the arrests, did they not, earlier you mentioned that there were clusters in prisons and
Mhm.
workplaces and everything. Do you not think the arrests may have contributed to the clusters in prisons, or was it carried out in a different manner?
It's not arrest as in these people were brought to prison. So
Right.
these were more of they were given out summonses to pay for. Currently, the penalty for violating the movement control order is straight away you get a 1,000 ringgit in penalty. So those are the things that were in place. In terms of the clusters in prisons, those are actually the ones that are prisoners who are already in there. And then for the factories and workplaces, most of these clusters happen in places where the workers were living in small confined spaces, such as dormitories. So those were, I mean, it's almost impossible to implement the what is it called, the physical distancing in
Right.
places like that.
Okay, moving on to the topic of vaccines now. Malaysia has over 55 million doses of vaccines on order. These include the Pfizer vaccine as well as a couple of Chinese candidates. Um Inoculations with the Pfizer vaccine have begun today. What is Malaysia's vaccination strategy?
Okay, for the national strategy for immunization, or what we call the national immunization program for COVID-19, we are targeting. There will be three phases to this distribution of this vaccine. The first phase will involve the frontline workers, such as healthcare workers, the police force, the armed forces, those who are in direct contact with the community, whereby their nature of work is to be susceptible to infection. Then the second phase should be sometime in May. That would involve those with the high risk population, not high risk to get the vaccination, but those who are high risk to develop complications, severe complications of COVID-19, such as those with comorbidities such as uh, obesity, diabetes, hypertension, and also renal failure patients. Then the third phase will involve those who are healthy adults above the age of 18 years old. This will take on for another few months. If not mistaken, it's towards the end of the year. How well this will be implemented, it will be, we have to see how it goes, because uh, the first, second, and third phases would involve different forms of vaccines, which will be acquired by the government.
Right. Okay, so to put a timeline to this, you said the third phase would happen by the end of this year. So, do you see Malaysia, a big portion of Malaysia's population, getting fully vaccinated by, let's say, the beginning of 2022?
Our target is to achieve herd immunity of 80% of the population. How well that can be implemented, we have to see it, because at the moment we are battling. I mean, it's the same as everywhere else in the world. We are battling. We're having a hard time with the infodemic. We have a hard time with the misinformation, disinformation. I mean, people are saying the vaccine is just another way of controlling the population. It has some 5G elements to control your mind and all these chips and Bill Gates behind it on and all that stuff. It may seem, for us, it may seem a bit difficult to understand. I mean, we can't brain this because it seems illogical. But for the general public, especially in the general community, which have a less, the education level isn't as high, these are their bread and butter. This is what they believe in. So it's a very difficult task ahead. And so far, we've been handling it. Um, I wouldn't say the best way we can, but we are handling it slowly.
Glad that you mentioned misinformation because it's some and infodemic because it's something that has plagued this pandemic, from denial to conspiracy theories and the likes. We've seen the whole spectrum, to be honest. So the information ecosystem in Malaysia also is very interesting. And on that note, I would want you to just talk a little more on how the COVID information space has evolved in Malaysia, and more importantly, how at your Medical Mythbusters Malaysia, what are the unique challenges that you've faced in 2020 with regards to infodemic management. Yeah.
Okay. Since the start of the COVID-19 pandemic, we've seen that more organizations, more agencies, and even the government are aware of what we call as risk communication. They are now more aware of what we need to do to convey proper information to the public. And since this year, we've seen a lot of agencies, for multiple agencies coming together to deliver messages that are based on evidence, factual, and things that can respond to this infodemics. So now we have worked for Medical Mythbusters Malaysia. We have formed links or networks with government agencies such as Ministry of Health, Ministry of Science and Technology, which we call MOSTI, which they are the ones who are in charge of the acquirement of these vaccines. So we've gotten in touch with all these agencies to figure out which are the best ways to convey this information, which are the best ways to battle or to battle this misinformation. So the keyword is forming alliances together. I mean, individually, we can never do this. The government sector needs the NGOs, and the NGOs need the government sector to brief us and to inform us what are the plans ahead, so that we can convey the messages properly.
Okay, at this point, I would like to point out to the viewers that Dr. Firdaus is currently tasked with the public communications concerning the COVID vaccine in Malaysia. So, how big of an issue is vaccine hesitancy in the country, historically and now for this vaccine? And what do you think is your biggest challenge in these efforts?
Mhm. I think this is something that's it's all over the world. In 2019, the World Health Organization considered vaccine hesitancy as one of the top 10 most, I mean, not dangerous, I would say, harmful to the public health of the world. So this is something that we have noted since our formation back in 2016. In 2016, we have noted there is a sudden increase or a sudden increase of cases. I think elsewhere there's measles. Malaysia also, we have increased cases of measles and also diphtheria in our communities. Initially, me and myself as a medical officer working in the government sector, when I was in the hospital, I've never seen diphtheria cases. I've never seen measles before. But suddenly, since the beginning of, I think social media has something to contribute as well. All these algorithms actually feed to this misinformation. So since the beginning of the advent of social media and its role in dissemination of the misinformation, we've seen an increase in vaccine hesitancy. So that one we can see we can see the trending issue of vaccine preventable disease making a comeback in Malaysia and even causing death. So that's been something we've been working on, and we've been working on slowly. Initially, we were working in silo. I mean, to be honest, but then eventually, as there were more NGOs coming in, the government sees us as a potential um, a potential use, or we can benefit. We can convey something to the public. Then things started to move on. And I think since the COVID-19, I mean, there's something at the end of the tunnel. I mean, there's a silver lining to it. People now see the threat. I mean, the government now sees that what we've been saying before this, anti-vaxxers can be harmful to the public eventually. Now they're seeing it, and now they're taking it seriously. So in that aspect, with regards to the anti-vaxxers, or what the proper term would be, vaccine deniers, we have come. I mean, we have followed what has been advised by the World Health Organization. We do not target, or we do not engage and give education or information to those who are considered as vaccine deniers, as they are the ones that have a fixed belief, and whatever you say won't be useful to them or to us. But we are targeting the vaccine hesitant individuals, whereby they can be they are fence sitters. So we by giving them proper, easy to understand data, proper, easy to understand information that they can relate back to their lives, those are the ones that matters most. And I think we've seen for the COVID-19 vaccine, we've seen a lot of conversions from those who are vaccine hesitant. After we've given them enough information, whatever they wanted to know, then they are more comfortable with getting the vaccine.
It's interesting. Yes, you also mentioned the role of social media in the whole anti-vaccine spectrum. How crucial is social media to the NGOs as well as the government in tackling this whole the anti-vaccine movement? How does it fit into the strategy?
So because we are bringing the war into the war zone. I mean, this is where this misinformation, disinformation, this is where it breeds. Social media is where all this misinformation breeds. Is a cesspool in there. So in order to target those people, we need to be right in the action. So that's why we are here. It's just that doctors or even scientists, they're not the best storytellers. They are not the best communicators. So we fit in that role. We have that insight of being in the system. We see the impact of something such as COVID-19 or vaccine preventable diseases, and we manage to convey these messages without interfering with confidentiality issues,
Mhm.
so that we can package it and we can inform the public in ways that they can understand. The best method is actually by storytelling, because anti-vaxxers or these movements, they use testimonies and they use storytelling. So you bring the war to them. You use the same strategy to bust all these medical myths.
Mm.
So that's what we do.
It's interesting. Now, like I mentioned initially, there have been over 288,000 cases in Malaysia. Deaths have been relatively low. However, healthcare infrastructure as well as public health systems do take a toll. So, talk us through how Malaysia's public health fared during the pandemic vis-a-vis the immunization coverage amongst children, the access to treatment facilities for people suffering from diseases such as cancer and the likes.
Okay, it's been a tremendous burden to the public health and also the hospitals. Initially, in the early phases of COVID-19, a lot of medical services were halted. Uh, like the appointments are being rescheduled, elective cases of surgery are being rescheduled to another date. So that really impacted some of the healthcare for the community. But eventually, I mean, we figured out that things needs to move on. So we managed. I mean, the government managed to implement steps to ensure that there are gatekeepers in place, so that all these patients can still get their medications, their medical attention, surgeries done. But in order to prevent any outbreaks in the hospital, we have that gatekeeping process. We screen them, we do the antigen screening and all that. So we somehow managed to continue with all the normal, I mean, hospitals and clinics functioning like normal, but at lower capacity and limited capacity, as we are and making sure that the clinics and hospitals are not overcrowded. So I can't say that everything is fine, but the healthcare is still being provided to the general community. Yeah.
Okay, I want to talk about COVID strains, the newer version of strains that are coming out. Uh, it's big in the news everywhere. The UK strain, the South Africa strain, it's becoming a big threat in India as well. Uh, how is it figuring out in the whole story in Malaysia? Is it recognized as a threat right now, or is it still not a big issue?
Um, Recognizing as a threat, yes. There's been multiple announcement by the Ministry of Health about the impact or all these new strains or variants of COVID-19. But as a general, even though if there's a new strain, variants of all types, we are still sticking to the public health measures that are already in place. Even though if it's a UK variant, South African variant, you still need to have that social physical distancing. use of face masks, and also proper hand washing, and also use of hand sanitizer. So as a public health perspective, it doesn't change much, even though we've had the UK variant here. But in terms of the numbers, we're not seeing a drastic increase due to the UK or South African variant.
Okay, quick final question, and very briefly, how do you see 2021 shaping up in Malaysia with respect to the pandemic unfolding? The rest of 2021.
21, I'm hoping that 2021, I mean, I'm hoping that the coronavirus, COVID-19, would be, I mean, there'll be a drastic reduction in Malaysia. But to be honest, I don't think 20 will be able to recover by 2021. It's going to take a long time for herd immunity to develop. I'm expecting maybe 2022, middle 2022, for everyone to be vaccinated and also develop that herd immunity. In the meantime, we still have to maintain with all the public health measures. As I mentioned earlier, life will not be back to normal, and believe me, it's not going back to normal, but it will resemble some sort of normality with there's talk about the vaccine passport, and movement will be allowed but limited. So hopefully this would improve, and our economy will improve as well. As you know, COVID-19 has been very bad to the less fortunate communities. We have what we call as B40, below 40% of the people with a low income. So hopefully by 2022, everything will be resolved. We get back to partially living a normal life. So yeah, I'm really hoping for that. I really want to travel.
So do we all. Thank you, Dr. Firdaus, for your time. Thank you very much. And thank you, everyone, for watching. Until next time, take care and bye bye.